The next topic is workforce safety and how to protect the workforce. We have Dr. Juliette Pio and Dr. Pierre Albaladejo. And I will hand over. Actually, Dr. Pio is working right now, and she pre-recorded her section. So, Mike, I'll hand it to you so that you could go through this next topic.
Good morning, everybody. My name is Juliette Pio. I'm here to talk about our experience here in Grenoble about the workers' protection and training in simulation. So yes, to begin with, as you may know, in every crisis we can highlight some concerns regarding the healthcare workforce management. You will face for sure rapid changes in almost everything and constant updates in number of beds in your units, number of units opened, night shift or your schedule or childcare, etc. So you have to take it into account to manage workers. It's going to be a stressful time for sure, and something which is more specific to COVID, I think, is it's a life-threatening crisis. To compare with a terrorist attack, for example, you won't die of taking care of people of a terrorist attack, but for the COVID, mostly you won't die of it, of course, but you might be infected just by doing your job, and so then you might infect your family, and that's very stressful for workers and for people working in a hospital generally. So to address these issues and to reinforce workers' confidence and self-competency, we developed a training with 4 axes. We wanted to offer self-protection to people, to offer a tangible training, so mostly using simulation, and to have written and printed procedures directly accessible in they were available directly in the units, so you can use it as you work with a COVID patient. You can find here on the right of the slide some videos from the French anesthesia and the French intensive care societies. We used those videos to help us create our own checklists here in Grenoble. So what we did here, more specifically, is that we set up a simulation scenario with the simulation team, and to address previous discussed issues, how to be protected, how to dress and undress, and for COVID units in ICUs, how to conduct airway management for COVID patients. So first, we prototyped the scenario and tested it directly in the ICUs involved with COVID. We set up the scenario and mannequin in an empty room directly in the ICU, and all the medical and the paramedical staff were able to be trained at the same time. For those ICU, we offer training about how to dress, how to undress, and how to intubate the patient, and how to use the suction device, which is a bit specific for COVID patients. In parallel, we trained some of our nurses who were free at this time in order to increase the number of instructors for the simulation scenario. Because I don't know how it works for you here in the US, but here in France, most of our instructors in simulation are also a physician in the ICU or anesthesiologist. And so during the crisis, they were not able to do both simulation and ICU. So we needed to increase the number of instructors to conduct the training. In a second time, so this part was done during the pre-pandemic phase, I would say. We were very lucky to have time to prepare and to train people. So I would suggest, if you have time, to do so as well. Secondly, during the pandemic phase itself, we offer the same training, but this time in the simulation center in order to free up space in the ICUs. This training was for continuous training, surely, but also for non-medical staff, radiologists, swab teams, residents, etc. People were able to join this training using an online predefined schedule. And moreover, the previously trained OR nurses conducted the same training, but in the units, in the non-COVID units, or at least initially non-COVID units, because things may change very quickly, we'll see. This was done in order to provide self-protection and confidence and training, basic training, to all the healthcare workers here in our hospital, to not forget anybody, and we didn't want to have anybody infected by the virus because of a lack in the training. So yeah, that was our first idea. The training went very well and was very well accepted by teams. Yeah, that's it for me. I'm available for questions if you have. And do not hesitate to reach to the MLab or my colleagues if you have any more questions, and I'll be very pleased to answer. Thank you.
Thank you so much, Juliette. So we have questions. Dr. Pierre Albaladejo is going to be answering questions about this really important topic. It seems like simulation was a good way to get everybody accustomed to the mechanics and the emotional and psychological aspects of workforce safety and protection. So Larry, I'll pass it on to you. Any good questions from the audience?
Well, we're monitoring it. I'll remind our audience again, please enter your questions in the Q&A window. If you come up with questions during these talks, there's also an ability, there should be an ability to click on the thumbs up to upvote questions. And right now we're taking questions on workforce safety and how to protect the workforce. So I'll start with one comment while we wait for some questions to come through. There was an interesting series of viral videos on, I believe it was on Instagram, and I'm not sure if other people have seen it, but the theme or the topic was, there is no emergency during a pandemic. And I wonder, Pierre, if you would comment on that, and if you could comment on the role of simulation in that. But the idea behind these videos, which were made by healthcare educators, is that we should be careful to protect ourselves with PPE before responding to an emergency, because if we endanger ourselves as providers and we become infected because we go to respond to an emergency and we haven't taken the time to don or even doff PPE properly, we can endanger not only ourselves but others. So maybe Pierre, you could comment on this idea of there is no emergency during a pandemic, and maybe comment on the role of simulation in improving protecting the workforce.
Yes, thank you, Larry. So Juliette cannot answer because she is on duty in the ICU, so I will try to answer the questions. Yes, the beginning with the simulation center. In fact, we just stopped all our activities at the simulation center in Grenoble to transform the team of educators on those topics. Dressing, undressing, the PPE management, as Juliette said, intubation, extubation, aspiration, and like Rennes Hospital, Grenoble University Hospital was not under the tsunami like Strasbourg or Paris, so we had time to prepare. And the fact is that we felt, and we are less feeling now, a lot of fear from the healthcare workers about the virus. So We try to help them to understand and to train several times and to cross-check each other to check if they were doing mistakes during the undressing, particularly. The emergency, well, there are emergencies in the ICUs, but in fact, all the nurses are already dressed with part of the PPE equipment. They have the FFP2 and mask and also the glasses, and so they can react quickly. So the question is not the emergency. The question is to be sure that the healthcare providers will not make any mistake. They are all young, less than 50 years old, so they are less prone to have severe COVID-19. But we don't want to. We want to reassure them, and we want them to be sure that we are doing everything to protect them, and this is very important. And the psychological effect of the support, as said the previous speaker, is very important in this pandemic.
Okay, we have some questions coming in. How are healthcare workers being how are healthcare workers being infected from the virus if they're in full gear of PPE and not touching their face prior to hand washing? So I guess this question is that there are some reports of healthcare workers being infected with SARS-CoV-2. Apparently they're wearing full gear of PPE in the clinical setting. Are these cases of community transmission?
Well, in France, I don't know in Strasbourg, but in Grenoble, for example, we do not have any contaminated workers. Perhaps it's a chance, but I think that the real question is the shifts they are doing. We know that they are doing mistakes at the end of the shift. The nurses have a 12-hour shift, and we try to cut all these shifts by breaks to avoid those mistakes to happen. So perhaps is it the training? Perhaps is it because our PPE is effective? We don't know. We guess that all the contaminated workers were in fact contaminated at the very beginning of the crisis, when they were not used to use PPE, and perhaps they were not aware of the risk they were taking.
Okay, I think we have time for one more question. When PAPR, powered air purifier suits, are not available, what PPE do your staff use? And I think you've already said this, but they're asking, what is the number of transmissions that occurred between patients and medical staff?
The type of PPE, the type of equipment we use is very simple. A cap, a full head cap, FFP2 masks, glasses, plastic glasses, gloves, disposable gown with a plastic gown on top. So it's very simple, but in fact, we were anxious about any shortage of any of this equipment. And this was a question, because we had signals and information from the hygiene services that we were going to have a shortage. Till now, we do not have any shortage in those equipment, but we know that we have, for example, 10 days of stock of these equipment. So the equipment is simple, and the most important thing is to hand hygiene and to wash hands with hydroalcoholic solutions. And this is very important. Our pharmacy is producing our own hydroalcoholic solutions with the alcohol coming from Chartreuse. I don't know if you know the Chartreuse liqueur, which is just near Grenoble, in Voiron. So we had a stock of alcohol to do our own solution to avoid shortage.
Thank you. So just to clarify for our audience, FFP2 masks are equivalent to, in the United States, what we would call an N95 mask. And
Yes.
then you have nothing covering your neck and no face shield. Is that correct?
We use face shields but we didn't have face shields before. We begin to have this equipment, and we are using for intubation, extubation.
Okay. All right. Thank you.